All right, good morning, good afternoon, good evening, wherever you are, and welcome to this WHO webinar in partnership with PATH and Grassroots and with the support of TechNet. Today, we'll discuss the introduction to post-market monitoring of cold chain equipment. We'd be happy to know who's with us today, so feel free to introduce yourselves in the chat box and tell us your name and where you're from. You can also use the chat box if you need any technical support in case you have problem with hearing or anything, and I'll do my best to help you. If you have any questions during the presentation, please don't hesitate to use the Q&A box. So we would prefer and we would recommend you use the Q&A area to ask your questions so that everything is centralized and our colleagues can find the questions easily. You can use this Q&A area at absolutely any point of the session, so don't hesitate to write your questions, please. And then they will be answered at the end of the presentation if we have time, and if we don't have the time, we'll probably reply or send you answers by email after the session. Finally, this session is recorded, and we'll share with you the links to the video or the recording, as well as the slides by email, plus additional content if relevant. I hope you'll enjoy this session, and I'll give the floor to Paul. Paul, the floor is yours.
Thank you very much, Alex. Thank you to TechNet for hosting us today. Very warm welcome to all of you. I can see we have people from many locations. Thank you for joining us today on this brief, just 1 hour session to introduce WHO's post-market monitoring project. And this session is done in partnership with Dania Arif from Grassroots and Matt Morio from PATH. And it really is a partnership. And we're hoping that at the end of today's session that we might find some more partners out there in the world who are interested to collaborate with us to work on some post-market monitoring. I'm part of the WHO HQ team responsible for the pre-qualification of immunization equipment and devices. So our role is to specify, so to write the specifications and the testing protocols, and then to assess the applications from manufacturers and to do the pre-qualification. There's also an important role that we have, which is what this session is about, which is post-market monitoring. And we'll be honest, it's the area which needs the most increase in resource and activities. So we're very on top of specifying, verifying, and pre-qualifying, and then the equipment goes out into countries. I'm sure many of you work with the cold chain equipment that's pre-qualified by WHO. We get very little feedback on how that equipment is performing. And what we'd like to do in this session is to introduce one of the programs we have, PMM, post-market monitoring, and to hopefully encourage you, to encourage EPI in countries to collaborate with us to further our post-market monitoring activities. I'm here, sat next to me is Edda Magnus. Edda has been with WHO's PMM since the beginning when we first started to work on this in 2018.
2018, yeah.
2018. So the agenda, we're going to split this in 3 parts. We're going to have a Q&A hopefully after each session. Please put all of your questions into the Q&A, or if you want, you can put them into the chat, and I'm sure we won't get to answer all of them today, but every question that is sent to us in the Q&A or the chat, we will absolutely be answering it, and there'll be a document going out. So be sure that we will answer each and every question that you have. Next one. Okay, so what do we mean by PMM? Our definition that it's the collection and analysis of performance data, then that's the performance of the equipment. We're specifically interested in how that fridge is working. And if it's not working, we like to work with EPI to find out the reason so that we can fix that issue, not only for your country, but also for all the other countries that are having that equipment. And the way that we do this is not by trying to monitor every fridge in the system. No, we do what we call a sentinel surveillance approach, whereby we deliberately select a number of facilities where we know the staff are interested and capable and resourced to be able to do zero reporting and follow-up. And we found in the pilot that we launched that sometimes in one country we only had 40 fridges that we were monitoring. In another country we had up to 150. But from that very small amount of equipment, we really got valuable feedback on performance and made a difference to the next generation of equipment. So there are two purposes. So us here in Geneva, we want to find out what's wrong, what's malfunctioning, and what can we do to fix it, both with the manufacturer and with our specifications. If an issue is caused by a specification, then we hold the pen, we can change that. When we identify an issue, we work with manufacturers so that they can solve that issue, so that there can be corrective action in the country, and that preventatively going forward, there's a change in the manufacturing process or a part, so that the next generation that goes out to the 70 countries we serve is fixed. But also, of course, at the national level, there's valuable information, program information that's very useful to the program. So through doing the post-market monitoring, as well as understanding specific performance issues with equipment, there's also valuable program issues that are helpful to the countries to improve on their program. So the methodology that we used is identifying. It's not random. You pick the site where you know the healthcare workers are willing and able to provide monthly zero reporting. It's very simple. There are only 8 indicators, as you'll see. It's not a heavy task to do the monthly zero reporting. So it's not a big burden on countries to introduce this type of monitoring. When we identify issues, of course, then we need to move through different steps and to visit sites. And of course, the person that we want to do that visit is the government EPI technician. Next.
So thanks, Paul. So on this slide here, you see the PMM indicators that Paul just mentioned before that are collected from the health centers through monthly zero reporting. And the idea here is really, as Paul mentioned, that should not be a heavy lift for the health centers that are taking part in this. These are 8 indicators, and actually really at the core, these are 3 temperature indicators that we are asking the health centers to collect information on a monthly basis. So we're interested in knowing the number of heat alarms and the number of freeze alarms specifically. And based on this information that's collected from the health centers, we have an initial idea as to whether there might be vaccines at risk in particular cold chain equipment. So as you see, there are 3 core indicators focusing on temperature, and then we have a few more to keep an eye on whether any build quality issues have come up, if there's any issue with the voltage stabilizer, and we also collect 1 question regarding warranty claims to get a sense of how quickly warranty claims are being dealt with. So at the core of this, 3 temperature indicators that are being collected on a monthly basis. And as Paul mentioned, at the heart of what we're trying to do with PMM is to try and understand how is equipment functioning on the ground, and most importantly, if it's not functioning, why? So we use these 3 temperature indicators to give us a sense of whether there might be an issue with the equipment. So we have certain thresholds. If there are 5 or more heat alarms in the month, if there's more than 1 freeze alarm, or if there's 1 heat alarm that lasts more than 2 days, 48 hours, then we can assume that something is going on. We don't know what, but something potentially is going on. So as part of the methodology, if any of these three are triggered through the monthly reporting, that triggers a follow-up process. So there are two steps to the follow-up, and it depends on the kind of complexity of the issue that we're looking at with a particular cold chain equipment. But there is a follow-up procedure, which is a light process that can be done over the phone, needs no particular technical knowledge or tools, with questions that guide the user to try and get to the answer, why is this fridge potentially malfunctioning? And in most cases, I would think we've seen in the pilot countries, this gives you the answer. Often it's a programmatic issue. It's been left open. There are some issues with electricity or power issues, etc. And that's where you have your answer. If you don't have your answer after going through the follow-up questionnaire, there is a more detailed failure analysis procedure that guides the user again through a more detailed analysis of what is happening with the fridge. And this needs to be conducted on site by a trained technician that has a set of tools to use. Just to give you a little bit of more background from the pilot that we did a few years ago. So we did a pilot in 4 countries, in DRC, Haiti, Pakistan, and Bangladesh. And this was more than 250 fridges that we monitored over 1 year. What we found was that about 15% of the cold chain equipment did meet one of these monthly thresholds at least once during the year. And then what we found when we went through the follow-up and failure processes was that about half of those cases, the reason why the temperature had been either too high or too low was due to either programmatic issues or external issues. They were actually not related to the fridge itself. So just under half of these issues that we encountered were actually due to malfunctioning equipment. A few lessons that we took away from the pilot. We saw that it was extremely valuable for the countries to have touch points with us here at WHO PQS, and also with the PMM working group to kind of discuss some of the issues that they were encountering. We also found that temperature data can only tell half the story. Having regular temperature data monitored and reported can give you an idea that there might be vaccines at risk, but it doesn't give you any sense of why they are at risk and then what needs to be done about it. And that's where the failure analysis comes in and is so important. What we did find in the pilot was that failure analysis isn't necessarily easy to do. It's not something that can be automated. It needs humans to actually carry it out. And sometimes it needs someone to actually go in person, start taking apart equipment and really doing detailed work. So what we want to do now as we're moving into a phase 2 of PMM is to really focus in on the failure analysis. And this is why we have been working with the team from Grassroots and from PATH as well to come up with an application, online application that makes the whole failure analysis process much easier and much more user-friendly. And that's what we want to focus on as we move forward to new countries working with us on PMM. So one last slide for you, Paul.
Yes, so if at the end of this session, anybody is interested to find out more or hopefully to collaborate with us to implement some PMM in your country with your ministry, we have a toolkit. So as well as the application, which you're going to see in detail later in this presentation, we have a whole list of documents to help you, guide you to support setting up a PMM activity. So just to let you know that it's plug and play. If you're interested, let's have a chat. Reach out to us after this and we can talk about it. And we have that toolkit ready to hand over to you, and hopefully we will support you as you implement.
So if there are any questions, I think we have time for a couple of questions potentially now. If not, We'll move on to the rest of the presentation, and we can take more questions at the end. Any questions on what we went through at high speed just now?
And don't worry, we can, as I said, we'll be answering all of the questions afterwards. We'll be able to provide you with a document with a full answer to all of the questions.
We have here a question from Hendrik on coordination with similar efforts by JSI and Village Reach.
Yeah, there are of course many approaches, and we try to coordinate. But yes, there are in different countries there have been different approaches. We hope that we found this to be very useful, and we hope that we could work with partners everywhere to get us all doing it in the same way. But also, it's very worth saying that any feedback, any actionable feedback on performance of pre-qualified equipment, we welcome it in any manner that it comes to us. So if you find you've got a problem with your fridge or your temperature monitor, and you have details, photographs that you can share with us, just by email is most welcome.
One more question. Is there a list of temperature monitoring devices that are permissible to use for gathering the numeric data?
So we have a specified, verified, and pre-qualified temperature monitoring devices, and we'll send the link as part of this Q&A, so that you can see the list of all of the pre-qualified devices, and there's lots of them, so that the choice from various manufacturers is wide. Okay, so we'll get to all of the of the answers, and now we're going to hand over to our colleague Matt, who's worked in this area for a long time, and is going to give the big picture.
Thanks, Paul, and hello, everybody. Yeah, so my name is Matt Morio with Path out of the US. I'm fortunate enough to be working on PMM since the initial stages there, and it's great to see the advance and everybody's interest. Just to spend a couple minutes briefly describing kind of the CCIS part of this. And so, as Edda mentioned, we have all the tools available in the toolkit, and one of the components of that tool is just kind of the digital collection. And Donnie will do a lot more in-depth kind of talking about how the PMM portion of it is designed. But the cold chain information system, or CCIS, is a digital cold chain inventory application, basically, that anybody can use. It's an open source available tool that will help you digitize your cold chain and allow for real-time collection of data in terms of the functional status of the equipment, the location, prioritizing if maintenance is needed or repairs, as well as tracking key important things like digitizing your maintenance records and repair logs, capturing spare part consumption. Some of the challenges that many programs face is not having that data to justify or explain why budgets are needed, or even location of spare parts to make it accessible for repairs. Warranty status of the equipment, especially through CCEOP. Much of the warranties are there, and making sure that we know which ones are still under warranty and which ones the warranties are expiring. And then also just really getting more data for action out there. So we've got a few slides here that we'll share out afterwards. But Paul, if you don't mind just kind of briefly scrolling through the next couple. So there's a lot of just, the data is in there, and it's interoperable with DHIS2 and other systems. And so we go from facility information down to equipment. Paul, you can keep scrolling if you'd like. About the refrigerators, and Danya's demo will have a little bit more of this. You keep going, Paul. Thanks. The maintenance repair log, we feel that this is a very useful piece here because it doesn't just have the job cards or what happened to the equipment at the facility, but it brings it up to the district, regional, and national level so we can understand what's going on there in particular. And then the last piece is temperature collection. That like other applications, the CCIS application can download the data directly from a fridge tag 2, or we can manually enter the information that kind of triggers some of the next steps for the PMM monitoring in terms of the temperature alerts. And so just this project was piloted and scaled in Uganda across all districts, and some of the outputs from that are being able to understand what is the functionality of the cold chain overall. On the left side, we blinded it by suppliers, but you can see what the 98% uptime, which is as many of you know, one of the metrics Gavi request reporting on for the supply chain parameters. We can understand, what if the temperature monitoring devices are working, is the voltage regulator present, and then also again understanding where the maintenance activities are. If the surge in the bottom right corner there, that green bar was because of a national effort to update the inventories and collect information. And then my final slide is just kind of showing a little bit more of the data for action in terms of how this is back from 2023. I don't have updated data, but what parts were consumed, where they were, and kind of what's going on in the country. So this again also like PMM is available for anybody interested. And then the nice part about this is it's all there. It digitizes your inventory and then allows the same application, which Johnny is about to show you, to collect the PMM data on top of the digital inventory system. Many of the stuff is also still available in Excel, but to make it more user friendly, this is an Android based app. So thanks.
Thank you very much, Matt. Yeah, just to underline Matt's presentation. So we didn't want to reinvent the wheel. So we found Uganda using this CCIS for their whole cold chain inventory and for their maintenance. And we found it to be very, very useful and really working well for them. The National EPI was very pleased with it. So for PMM, we just decided to add on our indicators onto the CCIS because we already had the inventory. And this turned out to work well for us. So I would encourage people to reach out to Uganda. They could reach out via Matt or reach out directly. The Uganda program has a really nice now inventory, and for those of you working in cold chain for a long time, you'll know that inventory management, maintenance, and repair has been an issue that we've struggled with over the decades, and this tool is really helping Uganda, that's for sure. So there's a couple of questions.
Yeah, I see, Matt, you've already answered one of them, I think.
I clicked the wrong button on that one.
The question at what level of the healthcare pyramid is the CCIS used?
Yes, so that is a great question. It's designed to be used across from national or central level all the way down to the facility level. It follows whatever administrative structure the country or EPA program operates with. If it's a 3 or 5 level system, it can accommodate that. We are also able to have cold rooms and freezer rooms in there, as well as just refrigerators and freezers. So all of that equipment is covered, and I know there's Nada's comment about if the other equipment is included. The inventory does ask for passive vaccine carriers or cold boxes availability and coolant packs as more of a kind of a static number, as well as temperature monitoring and voltage stabilizers. But those parts are not part of the PMM to the same scale as the cold chain equipment. And then the portion about the remote temperature monitoring system, currently, no. We can talk about developing APIs to link to that. There's just working towards that. The data standards across the different RTMs are there. It's just kind of harmonizing across. So the possibility can be there, but it's currently not an active feature.
Yeah, and just to add to that, we deliberately chose to use 30 DTRs because they were mandatory with all of the procurement of our pre-qualified fridges. So we were confident that there would always be a 30 DTR. But of course, in the future, we're looking to all the other temperature monitoring devices. And there was one other. There was a question about is PMM just for fridges? So at that we started with fridges, the big ticket item, the most important part, arguably, of the cold chain. So we start with fridges. If it works, of course, we would like to move on to other equipment and devices as well. So
Omalight's question for budgeting and advocacy. I think that the biggest thing, and that CCIS is able to do is capture that data from health facilities all the way up to the central level, and be able to see, for example, the spare part consumption. What are the most common parts being consumed and needing to be placed in the right places for repairs? Spare part budgets are often lacking, so being able to actually say to Ministry of Finance or even with an API, we need this much money for thermostats and compressors from this example here on the slide, or the circuit breakers we don't have enough of those. So like having that data there and also understanding the performance of the equipment, as PMM helps explain, is it human driven or is it the equipment itself? But just having usable data from your own experience is a great way to present it versus trying to dig through Excel files or paper records.
Thanks, Matt. So we here at WHO know of one project for machine learning to look at failure analysis to try and do predictive maintenance. We haven't seen the results of that. I'm sure that will come. And for the comment from Jerome in Cameroon, yes, we agree with you that Excel can be fine, but we hope that in the next presentation, you'll see from Dania that the app makes it much more easy to both collect and analyze the data. So thanks very much to Matt.
Thanks, Matt.
And now we'll move on to
keep
Dania.
Keep the questions coming. We'll respond to them at the end. Now we're going to hand over to Dania, who is going to speak to the post-market monitoring elements that have now been integrated into the CCIS application that Matt was introducing us to. Dania.
Thank you, Eda. So I'm Dania. I'm representing Grassroots, and for this part of the webinar, like Eda said, I'll be walking us through a detailed overview and a demo of the CCIS application. Next slide, please. And so before jumping straight into it, I just wanted to set a little bit of context around the work that is done on cold chain in general, and then the CCIS in particular. So our team has been working in the vaccines cold chain domain for more than 5 years now. And one of the earlier initiatives was the cold chain equipment monitoring and sentinel surveillance across 2 sites in collaboration with WHO and PATH, so in Bangladesh and Pakistan. And this initiative involved monthly surveillance of cold chain equipment across 2 districts in each of the 2 countries. And in Pakistan, this covered almost 220 ILRs and STDs, and in Bangladesh, this spanned 188 ILRs and STDs. And during this initial phase, data was collected through the fridge tag devices and sort of entered into the ODK application. And the activities lasted for around 18 months, after which the initiative was scaled up across 7 districts in Pakistan and expanded to cover more than 480 ILRs. During this time, the phase sort of continued for 3 years. And the CCIS application was also sort of upgraded. It was streamlined. The application was also linked to the Provincial Electronic Immunization Registry for Pakistan, which was functional across 30 districts in the country, catering to a population of more than 50 million people. And then building on this earlier work, the most recent phase, which is the focus of this webinar, that involved upgrading the CCIS application to make it compatible with the PMM implementation. And then along with the application, it was also accompanied by the development of a dashboard for enhanced cold chain equipment monitoring that I'll talk a little bit more about in the next few slides. Next, please. And so the objectives for this most recent phase involved upgrading the PMM system and ensuring the high quality and consistent data collection across countries. We improved and tested the survey tools, developed an easy plug-and-play package with guides and demos to support the EPI focal persons and the partners to facilitate the deployment of PMM. And we achieved this by, like I said, adding the PMM module onto the CCIS application in the form of 3 targeted surveys. Also developed a comprehensive system for PMM, optimized the user workflows, ensured high quality data collection. And then on the front end of the application, it involved sort of an overhaul of the UI for improved user interface and experience through redesigning the interactive elements and optimizing the form flows. And then in addition to the application, the team also architected a standalone GIS dashboard with which was integrated with the ODKX database. I will stop here and play a short video, which is going to sort of, give a more detailed overview of the application. But before we just run that, I'll clarify that the video shows all the possible PMM steps. And most of these are only needed when a more complex fault is identified. So like I think Eda referred to the fact that there's a monthly sort of survey, and then there's a follow-up survey and a failure analysis. So the video is going to walk through all the steps, but for all practical purposes, most of the users will only need to complete the simple monthly reporting. But we wanted to make the demo more comprehensive so that the users are given the entire sort of spectrum of the workflow that is possible through the CCIS. So I'll stop there and we can play the short video now.
Imagine opening an app and instantly seeing the entire cold chain network come to life. Every region, every facility, every refrigerator, all in one intuitive view. This is the CCIS app. Built for teams managing the vaccine cold chain, the app turns complex workflows into simple, guided steps. In this demo, we'll follow a user as they navigate regions, find equipment, activate surveillance, and surface performance issues with just a few taps. Let's begin. Once the user logs in with their unique username and password, the app opens into a clean, organized view of the entire cold chain network. Everything is arranged by region, so navigation feels natural and intuitive. To find any cold chain equipment, simply follow the regional pathway, drilling down to the lowest level. After selecting the target region, the user is presented with a complete view of all cold chain equipment available at that level. To make exploration effortless, the app offers multiple viewing modes: a clean, scrollable list view, a dynamic cluster-based map that automatically adjusts according to population density and equipment distribution, and a filterable list that helps the user quickly locate specific equipment types or models. Each option ensures the user can access the information they need in the format that works best for them. The filterable refrigerator list presents all cold chain units currently monitored through PMM. From here, the user can instantly narrow down the inventory, focusing only on the equipment they need to review or troubleshoot. On the detailed refrigerator screen, the PMM drawer remains disabled until the equipment is formally designated as under surveillance. Administrators with edit privileges can activate surveillance for that piece of equipment directly within the app through a simple, streamlined action. The PMM drawer provides quick access to the following actions: monthly surveillance, follow-up survey, failure analysis. Before walking through each of the 3 functions inside the PMM drawer, it's important to highlight how the application is designed to support field teams and supervisors. Each form within these functions has been built for maximum ease of use. Every question includes contextual hints to help the user provide accurate responses with tailored guidance. A library of reference materials is also available in the dedicated resources folder, and forms are organized into clear, logical sections. To further streamline workflows, advanced features such as skip logic and cascaded dropdowns guide the user step by step. This creates a structured flow that minimizes the cognitive load on field staff and helps ensure consistent, high-quality data, even in busy, resource-constrained environments. The monthly surveillance form enables the user to collect consistent, standardized data every month across all sites under PMM. It captures the essential indicators needed to understand how equipment is performing after installation and helps identify devices that may require follow-up attention. Each month, the user reports any heat or freeze alarms, spare parts replaced, build quality concerns, and details about any additional devices attached to the refrigerator, such as voltage stabilizers. As the form is completed, the application automatically evaluates the inputs to determine whether the equipment is functioning well. If a potential issue is detected, the system seamlessly redirects the user to do appropriate follow-up survey. The follow-up survey guides the user through documentation of refrigerator performance issues identified through PMM indicators. It ensures that consistent data is captured, helps determine which problems can be fixed without a technician, and flags when a technician visit is necessary. It also gathers pre-visit details that improve overall maintenance efficiency. All follow-up questions must be completed during the same call or visit in which the PMM survey was conducted. The user begins only when a refrigerator has been flagged for follow-up. They first review the PMM indicator results to confirm that action is required. Section A focuses on basic checks: placement, environmental conditions, drainage, gasket condition, and any visible corrosion. These assessments can be completed either on-site or remotely over the phone. If the failure cause is not identified in Section A, the user proceeds to Section B. Section B covers build quality checks and more detailed follow-up questions. This section is completed only if the user is physically on-site and the issue remains unresolved. The user uploads photos wherever possible to support the findings. If the cause is identified at any point, the app records it in the failure reporting module, including the specific components affected. If the cause is still not identified after both sections, the app automatically prompts the user to move to the failure analysis survey. The failure analysis reporting function is used when a refrigerator has been flagged for follow-up through PMM indicators, but earlier assessments were unable to determine the cause of the fault. It focuses on identifying and resolving immediate, verifiable causes of issues, such as poor cooling performance, emerging build quality defects, malfunctioning voltage stabilizers, etc. It must be carried out on-site by a trained CCE technician or a qualified assessor. During the visit, the technician uses advanced diagnostic tools to test components directly, confirm suspected faults, and rule out unrelated issues. The primary goal is to identify the root cause of the malfunction and document all findings for repair, escalation, or further analysis. Throughout the assessment, the technician records any failures observed, components affected, relevant performance readings, and supporting observations. To ensure accuracy and efficiency, the technician follows the structured failure analysis survey, completing only the sections needed to verify, document, or diagnose the fault. This ensures that all critical information is captured in a consistent format and supports timely, evidence-based maintenance decisions. And that brings us to the end of this demo. More than a data tool, the CCIS app captures the full story of each piece of cold chain equipment, from early warning signals to detailed diagnostics, ensuring challenges are identified promptly and teams are empowered to maintain reliable cold chain performance at every level.
I'll just wait for the slides to be back up. Yep. So I hope the demo sort of provided an overview of the CCI's workflow and the different functionalities that it has. And just to sort of summarize some of the key features. So the application is open source and adaptable, so it's completely contextualizable to the country needs. All the communication is end-to-end encrypted to ensure that it is compliant with the standard data privacy laws. It is also connected to a dashboard to provide real-time visibility of the entire cold chain network. And then as far as the design is concerned, it's technician-focused, end-user centric to optimize uptake. And then the application is also designed to be interoperable with any existing digital health tools in the country. So whether that's LMIS or DHIS2, it can be linked through the use of appropriate APIs. Next slide, please. And then in addition to the CCIS application, our team also developed a dashboard to display the data that is captured through the application in real time. So at the very basic level, the dashboard displays key performance indicators such as the total number of facilities, the total number of ILRs, the equipment verification results, the distribution of the functional and the non-functional ILRs across time and over geographies. And then in addition to these more basic indicators, there are also more advanced features that are incorporated in the dashboard. So a population map, a spider map that is showing the distances to the various health facilities and centers, and also a weather map that integrates the cold chain equipment data with the ambient temperature, which is crucial for cold chain planning because as you know, extreme weather events and temperatures, they can really have an impact on the cold chain performance. So the dashboard is sort of designed to bring together and all of those external elements as well, and to really enhance the predictive capability of the cold chain managers when it comes to managing the cold chain equipment in their respective countries. Next slide, please. And then before concluding, I just wanted to take a step back and sort of look at the bigger picture of how CCIS can really help facilitate, the cold chain managers and EPI teams to address a lot of the daily challenges when it comes to cold chain management. So firstly, through using the app, it enhances the national cold chain equipment visibility. So time and time again, in our experience, we've seen that often there's a mismatch between the number of equipment that is reported on paper versus what actually exists at the health facility. So the CCIS sort of, closes the gap between those inconsistent reports and the on-ground realities. So it enables real-time visibility of all the equipment that exists, the number, their functionality status, whether they're working, what are the reasons why they're failing. So it sort of provides a very comprehensive view of the entire cold chain network to the EPI teams as well as the cold chain managers. Secondly, it also eliminates any guesswork that is associated with diagnosing cold chain equipment problems. So, I'm sure from experience, we know that it's often very difficult to diagnose the cold chain equipment problems accurately, specifically when, not enough data is available. But through the structured checklists and the stepwise workflows, the CCIS, it ensures that those complex cold chain equipment issues are correctly identified and then they're also resolved timely. And then thirdly, it helps detect the faults early. So, for example, imagine that you know that a refrigerator is in trouble before the vaccines in it actually become at risk. And that's exactly what the CCIS application enables. So through the PMM indicators and the alerts, it flags the risks early, triggers fast follow-ups before the situation actually worsens. And in the longer term, it creates that preventive maintenance culture rather than being in a constant sort of crisis response mode. And then I think, as Matt referred to the fact that through having that entire visibility of the cold chain network, so what equipment exists, what is not working, why is it not working, it improves budget forecasting for managers as well, and also helps them prioritize resources where they are most needed. And then it sort of builds capacity across all levels of the system. So the sentinels learn how to identify the issues consistently. The technicians, they really sharpen their troubleshooting skills, and managers receive timely, high quality data, sort of leading to a culture of continuous learning as well. And then an important feature is that it makes the technician visits smarter, faster and more cost efficient. So from our experience, we know that technician visits are rare, but when they do happen and technicians, make the long journeys to the facilities only to realize that they don't have a particular part that they need to fix the equipment. So through the CCIS, when they're provided all of those pre-visit details, like the pictures, history of equipment failure, any suspected component that is needed, they can arrive prepared with all the tools. And this makes their visits more efficient and cost effective as well. And then in the longer term, the ultimate aim is to prevent vaccine wastage and, make sure that the vaccines are potent. So by using the CCIS, it also sort of ensures that the managers are provided all of that information to ensure the vaccines are kept potent. And then lastly, the CCIS, just a second, sorry. And then lastly, just to reiterate, the application is designed so that it seamlessly integrates with any of the existing country infrastructure. And so the countries don't have to, look at any overhauling of their existing technical infrastructure in order to use the application. And that sort of brings me to the end of my part, and happy to continue the discussion over Q&A.
Thanks a lot, Danya. We had a few sort of technical questions that perhaps to either Matt or Danya. Let me see. Actually, I'm seeing that Matt has been very, very effective in answering a lot of these questions. So we still have one open question from Omelay on training requirements for the technicians to be able to do this RCFA analysis.
It's a good question, Omelay. So a certified cold chain technician would just need to be made familiar with how to use the app, how to fill out the survey, because I'm assuming that technically they're, as we know, many of them are absolutely excellent technicians. It would just be a case of a learning time for them to get used to using the app. But we think it's been so well designed that should be, which I hope you came across in Danya's presentation, that it is very intuitive and logical and bringing you through. So I couldn't put a timing on it, Omelay, but it's short for a technician to get used to using the CCIS and the PMM. It's been very well designed, as I hope you saw here. And of course, you now have the opportunity to be able to, if you reach out, we'll be able to share with you, and you'll be able to prove that concept.
So we have another question from Omelay as well on whether the dashboard can show countries their overall average equipment functionality rates. This is perhaps an overall question on the CCIS app.
Matt, what would you say to that from Uganda's experience?
In Uganda, the Vaccine Management Committee meeting said that I think you're part of Omelay, sees the data from there. And so it's not necessarily an average, because it's actually the real-time functionality of that. And so, at any given moment, you can look and see, is it 98.5% or 97% of the performance level, provided that the technicians are updating the functional status of the cold chain equipment, right? The tool is only as good as the input that goes into it. And to kind of go back to your training question, as we did for the Uganda example, we brought all the cold chain technicians together and trained them on the CCIS application and did a 3-day training on that side of things. The PMM questionnaires themselves, we also in the pilot countries had Sentinel officers basically out there able to collect the data. And went through training on them of not necessarily the application itself, but just what are the questions and how to answer them. which is part of the toolkit that Eda mentioned before of the data is there in Excel as well as within the app, and so just kind of what do we answer, how do we answer it, and the frequency of that. But happy to talk with you more about offline too, if that helps.
Thank you, Matt. So Abu Bakr has a question about, is there a plan to train international consultants for this? At the moment, Abu Bakr, there is not a plan. The pilots, we work directly with an in-country partner and with EPI. So we worked with organizations that were already part of assistance to national EPI and who already had good relations with national EPI. And of course, as WHO, we work primarily with the EPI itself. To the next slide.
Any further questions, or we still have a few more minutes, perhaps, as you think through your last questions. Just to highlight, so as we've said a number of times in the past hour, there is a package of PMM guidance materials and tools, and they're available on the WHO extranet page. And you have the link to the page here in the slides that will be shared with you. We are hoping to identify up to 5 countries for PMM implementation next year. And as we mentioned earlier, what we're hoping to really do now is to further test the CCIS specifically, as well as the failure analysis. And these are the 2 pieces that we felt after our first round of countries, we need to work more with countries to make sure that we're getting this absolutely right. If you are interested in implementing PMM, or if you want to learn more, if you have any further questions after today's session, please don't hesitate to reach out directly to the WHO PQS team, and we have the email addresses of the team members here on the slide. And we'd be very happy to speak to you, give you more details, and talk you through what implementing PMM in your country might look like.
Thanks, Eda. So I'd just like to apologize to everybody whose first language isn't English. I'm afraid today we weren't resourced to have translation services. We'll look to that for next time. So just I'd ask you to please accept my apology for it only being monolingual today. And as Eda said, please, if you have any further questions or you want to ask your questions offline, of course, just write directly. There's my email is there along with my other colleagues, and we might not get back to you in 24 hours, but we'll definitely get back to you. Okay, so I'd like to thank our partners. I'd like to thank Danya Arif and the team at Getty at Grassroots. We've been working with them now with these individuals for a long time, and we've built up a good partnership. So thank you very much, Danya, to you and the team. And we're very happy with the PMM addition to CCIS. We think it's going to be very helpful and useful for countries and for us. And thanks to Matt and his colleagues at PATH. PATH have been the longest standing technical partner to WHO's immunization program since we started in 1975. So, well, Matt didn't start himself, did it, but PATH did. And thank you to Alex from TechNet for hosting us today and making sure that the video played correctly and other technical matters behind the scenes. So thank you very much to all of you, and thank you especially to all of you joining from all over the world. It was very nice to see the list of your names there, and I hope that you are encouraged to consider doing PMM, and we look forward to hearing from you and hopefully in 2026 collaborating with you. So I'll wish you a good end to the year and hope to hear from you. Thank you very much.
Thank you, everyone. Thank you for joining us.